Coccidiosis is a prevalent parasitic disease in chickens caused by protozoan parasites of the genus Eimeria. This disease affects poultry globally and has significant economic implications due to reduced productivity, increased morbidity and mortality, and the cost of treatment and preventive measures. This video provides a detailed overview of coccidiosis in chickens, encompassing its etiology, epidemiology, pathogenesis, clinical manifestations, diagnosis, control, and management. The causative agents of coccidiosis in chickens belong to the genus Eimeria, which comprises multiple species. The most common pathogenic species in poultry include Eimeria tenella, Eimeria maxima, Eimeria acervulina, Eimeria necatrix, and Eimeria brunetti. Each species exhibits tissue tropism, infecting specific segments of the intestinal tract. The life cycle of Eimeria involves asexual and sexual reproduction and requires a single host. The infectious stage, the oocyst, is shed in the feces and becomes sporulated under suitable environmental conditions, such as moisture, oxygen, and moderate temperatures. Sporulated oocysts contain sporozoites that are infectious to chickens and initiate the parasitic cycle upon ingestion. Coccidiosis is a ubiquitous disease in poultry farming systems, with its prevalence influenced by management practices, environmental conditions, and host factors. Intensive poultry production systems, where chickens are housed in close confinement, create ideal conditions for the rapid spread of Eimeria oocysts. Transmission occurs primarily via the fecal-oral route, with chickens ingesting contaminated feed, water, or litter. Factors such as high stocking density, poor sanitation, and environmental stress exacerbate the risk of coccidiosis outbreaks. The disease is more common in young chickens due to their underdeveloped immune systems. The pathogenicity of coccidiosis depends on the Eimeria species, the infective dose, and the immune status of the host. Following ingestion, sporozoites are released from sporulated oocysts and invade the epithelial cells of the intestinal mucosa. The parasite undergoes asexual multiplication, schizogony, causing extensive destruction of intestinal cells. The damage to the intestinal epithelium results in malabsorption, loss of fluids, and compromised barrier function. Severe infections may lead to hemorrhagic enteritis, particularly with species like Eimeria tenella and Eimeria necatrix. The immune response to Eimeria infection involves both humoral and cell-mediated components, although immunity is species-specific. Coccidiosis presents with a wide range of clinical signs, depending on the severity of infection and the Eimeria species involved. Clinical signs may include mild infections with reduced feed intake, slow growth, and mild diarrhea. Moderate to severe infections lead to bloody diarrhea, dehydration, lethargy, ruffled feathers, and significant weight loss, while acute infections might cause sudden death, often associated with Eimeria tenella or Eimeria necatrix. Subclinical infections result in reduced feed conversion efficiency and growth performance, impacting overall flock productivity. Diagnosing coccidiosis involves clinical observation, necropsy findings, and laboratory testing. Effective control of coccidiosis requires an integrated approach combining good management practices, vaccination, and chemoprophylaxis. Continued research and innovation are essential to mitigate the impact of this disease and ensure sustainable poultry production.